fixed splitting of the second sound. Fixed splitting of the second sound refers to split sound which displays little or no respiratory variation. The two components making up the sound occur in their normal sequence, but the ventricles are unable to change their volumes with respiration. This finding is typical in atrial septal defect, but is occasionally heard in congestive heart failure. The fixed split is heard best at base left with the diaphragm. The following example demonstrates a widely fixed split second sound. This was taken from a patient with an atrial septal defect. Concentrate only on the second sound and try to ignore the murmur which precedes it. The murmur will be discussed later. Fourth heart sound. The fourth heart sound is a low-frequency sound heard just before the first heart sound, usually preceding this sound by a longer interval than that separating the two components of the normal first sound. It has also been known as an atrial gallop, a presystolic gallop, and an S4 gallop. It is most commonly known as an S4. The S4 is a diastolic sound, which occurs during the late diastolic filling phase at the time when the atria contract. When the ventricles have a decreased compliance or are receiving an increased diastolic volume, they generate a low-frequency vibration, the S4. Some authorities believe the S4 may be normal in youth, but is seldom considered normal after the age of 20. The abnormal or pathological S4 is heard in primary myocardial disease, coronary artery disease, hypertension, and aortic and pulmonic stenosis. The S4 may have its origin in either the left or right heart. The S4 of left ventricular origin is best heard at the apex, with the patient supine or in the left lateral recumbent position. Its causes include severe hypertension, aortic stenosis, cardiomyopathies, and left ventricular myocardial infarctions. In association with ischemic heart disease, the S4 is often loudest during episodes of angina pectoris, or may occur early after an acute myocardial infarction, often becoming fainter as the patient improves. The S4 of right ventricular origin is best heard at the left lateral sternal border. It is usually accentuated with inspiration and may be due to pulmonary stenosis, pulmonary hypertension, or right ventricular myocardial infarction. Since the S4 is a low-frequency sound, it is best heard with the bell lightly held. Listen now to an S4. During the recording, the fourth sound will be removed and then added again. Now listen to an actual fourth heart sound, recorded from the apex of a 60-year-old male with cardiac disease. Now compare the timing and quality of the S4 with that of a split first sound. First, the S4. And now, the split first sound. Third heart sound. The third heart sound is also of low frequency, but it is heard just after the second heart sound. It occurs in early diastole, during the time of rapid ventricular filling. This sound occurs about 140 to 160 milliseconds after the second sound. The S3 is often heard in normal children or young adults, but when heard in individuals over the age of 40, it usually reflects cardiac disease characterized by ventricular dilatation, decreased systolic function, and elevated ventricular diastolic filling pressure. Its nomenclature includes the term ventricular gallop, protodiastolic gallop, S3 gallop, or the more common S3. When normal, it is referred to as a physiological third heart sound and is usually not heard past the age of 40. The abnormal or pathological third heart sound may be heard in individuals with coronary artery disease, cardiomyopathies, incompetent valves, left-to-right shunts, ventricular septal defect, VSD, or patent ductus arteriosus, PDA. The pathological S3 may be the first clinical sign of congestive heart failure. The S3 may have its origin in either left or right heart. The S3 of left ventricular origin is best heard at the apex. The S3 of right ventricular origin is best heard at the left lateral sternal border. The S3's low frequency is best heard with the bell lightly held. Both S3 and S4 increase with exertion and become fainter with the patient sitting or standing. Third heart sounds are often associated with sharp outward precordial movements, which frequently can be seen or felt. Listen to the following S3. The third sound will be taken out occasionally to enable you to determine its position in the cardiac cycle. The following example demonstrates an S3 in a patient manifesting congestive heart failure. Since the heart rate is rapid, one of the first compensatory mechanisms of failure, one has the impression that there are 3 sounds with each cardiac cycle.